University of Colorado Hospital. I'm going to get them confused being a CU guy all the time. How does Children's Hospital play into the mix?
Children's Hospital is also a separate entity, but its faculty, the doctors who practice there, are part of the University of Colorado. So
Right.
like us, we have a very close relationship, and we're very interdependent. And while we're separate entities and we have separate board of directors, each of us, all the doctors come from the University of Colorado.
Yeah.
We essentially, they come over and work with us, and we help support them.
Mm-hmm. Now, the VA hospital is going to play into that as well. It's almost as if you're going to run out of parking out there eventually because there's going to be so many people.
Well, it's one of the complaints we have heard because we've grown so quickly. That's why we're adding so much parking as we build. We're building underground parking now at our place. And so it is a concern, but we still have opportunity. We planned it, I think, in a way that we still have some opportunity to add as we grow in the future.
Is the growth of health sciences principally because the baby boomer generation is coming along and they're saying, oh, these people are going to need all kinds of help and all kinds of research for them?
I think it's a combination of factors. I mean, for us, I think it's a factor that people many more people than historically came to us are coming to us because of the kind of quality we provide to the Rocky Mountain region. There's also the demographics, as you point out, where each of us are aging, and the curve in this country is an aging curve. And two, we're able to identify diseases and problems much sooner with the technology we have. So there's a lot of factors that synthesize to contribute to the growth that we're seeing.
Of all the things that you have on campus now, what one service or research would you like to see go on there that's not taking place?
That's a great question. I think, as I say, I think there's research in just about everything.
Yeah.
What I'd like to see more, I'd like to see how do we provide a higher quality product to families. It's more of less a research project, but how do we provide a better care to the Rocky Mountain region? And it's more of a larger issue in the economics and the number of faculty and staff we have to support that.
Yeah.
But from a research perspective, there's almost no area we don't cover. The reality is we need more, and that comes from federal funding and then from private funding. And there's not enough of it to do all we'd like to do to really come up with solutions and perhaps cures for different diseases.
There are a number of for-profit hospitals in the area, too. Do they do things with the campus, too? Do you support them in any kind of way that you know of?
No, I think we're the only academic organization, academic institution in the Rocky Mountain region. There is no other academic medical center. So we operate relatively independently in that regard.
Yeah, because I know that there are a lot of them there, and I thought, the medical community, when something new is going to be discovered or taking place at CU, then maybe that's a good place to spread it to, because the other guys happen to be here in town.
Yeah, we certainly collaborate, but most of the research goes on right at our hospital, and of course we share everything we learn.
Yeah. Is your campus being used as a model elsewhere in America, and what may some of those places be?
It's interesting you ask that question. It's being used both internationally and nationally. I've had visitors from England recently. Yeah. About 3 or 4 weeks ago, came to look at our campus. They're going to do something similar. Yeah. And today, just this afternoon, I talked to an individual about a campus that's being conceptualized in Riverside, California. Really? An old Army base. So it's being used as a model, because I think nobody expected this to be as successful as we are from every vantage point, both from a clinical perspective as well as an economic perspective.
And it was a pretty fast success as well.
Yes.
Because usually these things you build out up over time and you see how it's going to do it. It may change, but it seems as if you guys just took off and just keep right on going.
Yeah, this was originally supposed to take 10, 15 years to get to where we are today. In fact, we're past that line as we looked at that. It's just been such demand, and we've been fortunate and able to build this so quickly.
It's I've been over there a couple of times. I was on something called the cacti study there, trying to find out how come I don't have diabetes and I'm over 50 years old. So I know the service, the quality of service is wonderful. Do you also research there how hospitals can better serve people when they come, changing procedures, that kind of thing?
Yeah, we clearly, and I think it's one of the things we want to do better across the country, and we certainly do our share of research in terms of how do we provide a better service to patients, how do we approach diseases from a different vantage point. So there's a lot of what I'll call that kind of sort of that delivery service research going on.
I think I read something about there's a test or a plan to do something with better utilization of medical records?
Yes, we are investing $70 million right now in a new electronic medical record for the hospital, so that we have, right now we have electronic records, but they're all separate systems. We want one centralized system where you can even access it from home as a patient. You'll be able to access the system from home.
Really? I'll be able to know what the doctors know, huh?
You'll know what the doctors know. Everything will be open. You can have access to everything that we have.
When is that going to? What's the timeline on it?
We've been planning on it and preparing for it now. We hope to begin phase 1 of the implementation in February, and that'll take about a year of implementation. It's very complex. A lot of education.
Yeah, I think so. Yeah.
It takes a lot of education of both the staff and the physicians, as well as, of course, our patients. And it's a very expensive technology to implement in this country.
So I would think if somebody's in an emergency room somewhere, the doctors have access to their records in like a finger snap.
Exactly. They'll be able to have access to everything. Wow. It's really a state-of-the-art system we've chosen.
It's better than trying to wear a wristband or something around or a necklace with all your information on it.
Yeah, this is really a state-of-the-art system that really I hope will serve patients and our providers in a way that really provides the best care.
The youngster wanted to get into the medical profession right now. Looking at that campus, what would you tell them to look at that could be exciting in the future for them to look at going to?
Well, first of all, I'd tell them, and we do work with the community. We're working with schools around the community right now, because the elementary schools, and I'm hoping those children that we're working with today will someday be students at our campus.
Yeah.
They've got to read, they've got to write, they've got to learn sciences, they've got to study hard. And that's what I basically tell them today. And we're telling them that. We're going to these schools. We're trying to develop a very close relationship with the community. I don't feel like being a fortress outside of the community. So we've been working with 3 schools recently in Aurora, Park Lane, Montview, and Paris. And we've been providing books. Some of the kids, we donated books, we donated back-to-school material. We did a lot of things. And some of the kids, it was really heart-wrenching at some level. Some of the kids said this is the first time they've ever had their own book. And we didn't do it the hospital didn't do it, the individuals in the hospital. All the people who work in the hospital donated.
One of the things that crossed my mind too regarding that, I was speaking with a couple of teenage young ladies who wanted to be forensic scientists, and I told them, you need to call somebody at the campus and find something about that. Is that something that takes place there?
Oh yeah, we have a pathology department, of course, and there's a lot of research that goes on there. So we can show kids and adults anything they need to, and we can help train them if possible.
Now the move to Aurora, because CU has been in Denver forever, what really prompted it?
Lack of space. If you look at that campus today, as we talked about earlier, that campus has spread and grown so much. There was a need to grow for the research. There was a research need for more laboratories. There was a need for more patient rooms, updated patient rooms. That was an old hospital. It was 50 years old on 9th Avenue. So it was the space considerations and the quality of the buildings were aging.
I know it had to be a big undertaking to move, because we thought push night at the airport was something when you moved Stapleton out to DIA. How was it for the hospital?
I will never forget. We moved on Father's Day, June 17th, 2007.
Yeah.
And the first thing we moved, and we were the little neonates, the babies that weigh a pound and more. And this was like a military exercise. We planned for a year or two to make this move. And the move was perfect. And when we knew when those babies, those neonates arrived, which was a challenge because they were in these big, huge boxes, so to speak. This technology that we used for them, and we had to have Hazel's construction help lift it because they were so heavy. The movers wouldn't move it; it was so heavy. And the construction people helped us move it, but it was like a military exercise, and it went perfectly. And then when those babies arrived over here at the new campus, we knew we'd succeeded.
Yeah.
And we moved then a couple 150 other patients.
Because you had to keep people hooked up and connected in and plugged in and all that
and
stuff.
The babies, too. Critical care patients our age, as well as these neonates that were days old. Had to keep them all hooked up and not a problem at all.
Not a problem at all.
And I tell you, it made us all feel very proud.
Oh, I bet it did. I bet it did. Even though it has nothing to do with Aurora at all, what's going to happen with the old campus?
I'm not sure what's going to happen. You know, the old campus they're working with shade developers, and the economy's had its impact. So there's some plans to put some hotels, put some condos, movie theater, but when that's all going to happen, given the economy, it's hard to tell.
Now, speaking of living things like that, is that in the plan for your location as well, maybe condos or houses on the north side there?
Well, there's a hotel being built across the street on Colfax on the south side right now.
Yeah.
And there's another hotel that may be built on the Fitzsimmons Redevelopment Authority land. There's a possible plan for a hotel there. And then there's other facilities that are going to be built around the campus. I think we're going to see huge development in that area. We're already seeing it.
Yeah, I think there's a VA home there, something too, that's on the campus.
That's been there for a number of years.
Yeah, it's one of the quiet aspects of that. I think it used to be the part of the old officers club or something there too. So the campus has a lot of history that it moved to, and it's making new history to go ahead. What things can we look forward to perhaps coming off of the campus?
Well, I think you can see, as we talked about, incredible facilities. And state-of-the-art equipment from the hospital perspective. Yeah. Enormous amount of research that will really help provide cures to cancer, to a number of diseases. So and a place for the community also, a place that serves our community and a place to educate the community also.
Speaking of education, can people take tours of the campus?
We will give tours of the campus, yes.
Really?
We do give tours.
Okay, because that's something I never knew you did.
Yeah.
And it would be fascinating to go out there and really see some of the things that are going on. You know, I need to be in that line too, especially us old guys, so we can know we're going to get plugged into this, we'll have that, and it can be right here, that's for sure. It's got to be an exciting job for you, too.
It's a spectacular job. I feel really fortunate to have this job to help build this campus, build a service that's really among the top 25 in the country. And to really work with the colleagues, I get to work with the faculty and the staff. Yeah. I feel very fortunate.
What's the one mark you'd like to leave on the campus? Eventually, because we know you're not retiring anytime soon.
No, I'm not retiring soon. But we want to be one of the best hospitals in America. We think we're on the way to being that. And really, therefore, providing the best kind of quality of care to our patients in this community and throughout the Rocky Mountain region.
Because we talk about the medical side, but there's an administrative side that has to run all that stuff. And to keep that going has to be an undertaking also, as well, a large one.
Yeah, because we get no money from the state, and because we have to run independently, and because we're doing all this teaching and taking care of all these underserved people, we have to run a very tight ship. And well, we have an incredible management team in our hospital and a great staff. Yeah,
I would think that that's another area where kids could look at. Maybe not on the medical side, but that administrative side, because that's a lot of work, and it takes some real good specialized people to get it done.
Yep. There's a lot of career opportunities.
Hey, maybe I can get another job out there.
Hey, come on out. We'll talk to you.
Well, thank you for the insight today, because every time I drive by, especially at night, you see those buildings, and I think I'm looking at downtown. No, it's not. But to know that all that is going on right next door to Aurora, and you get to lead a real exciting campus there.
Thank you.
All right.
Thank you very much. It's been a pleasure.
Mr. Bruce Schroffel, the CEO of the University of Colorado Hospital. Did I get it right?
Got it right.
Okay, by the end of the show, we got it right. I'm Adam Dempsey. Thank you for joining us for this edition of Dateline Aurora.
You're watching Aurora 8, nationally recognized for excellence in government programming.